afternoon, everyone, and welcome to Plymouth Medical's Lunch and Learn on the HARMOKNEE HA Reimbursement Solutions Portal. I'm very excited to be here today. My name is Joanne Tremblay. I'm the principal and founder of Plymouth Medical. I think most of you have dealt with my colleague as well, Elizabeth Sosa, who's a regional account executive and is a sort of direct point of contact for all things viscosupplement related when it comes to our clients and our company. So welcome. We are very excited today to introduce our new HARMOKNEE portal. So the HARMOKNEE Reimbursement Solutions Portal just kicked off on September 3rd. And what we're here to outline today is the functionality of the portal, help our clients enroll in the portal, help our clients understand what it can and cannot do, and also help you understand what benefit investigations and what our direct purchase program entails. So I'm going to kick off the call without further ado. So for those of you that have actually engaged with the previous portal, the Assembia portal, you're already somewhat familiar with the sort of the support that we offer through these HIPAA secure portals. So for one, you already know that the HARMOKNEE Reimbursement Solutions Portal can have or see your team outsource eligibility and benefit investigations for commercial insurance plans for hyaluronic acid products like Trivisc and Genvisc. This portal will also enable our clients to continue routing their enrollments of patients towards our direct purchase program, which again is a very successful program. We got started close to 2 years ago now that provides for direct out-of-pocket access for patients to Trivisc and Genvisc at $97 a syringe, or for $291 for the course of either 3 Trivisc or 5 Genvisc injections. One of the things that we've been really sort of keen on, as you all know, is customer service and the turnaround time. So one of the things we're very excited about this new HARMOKNEE portal is that it's going to massively reduce the amount of time that you need to wait for benefit investigations, for the determination of eligibility for viscosupplements, and also the amount of time for our teams to reach out to your patients to effect payment if you have routed them towards the direct purchase program. Furthermore, one of the advantages of the HARMOKNEE Reimbursement Solutions Portal that's just launched this week is also a sort of a direct route to providing patient access to direct purchase program if they've been found to have no benefits for viscosupplements. So in other words, if you want us to verify their benefits first and foremost and see whether their medical plan or their pharmacy benefits will cover for Trivisc and Genvisc, if they're found to have no coverage for viscosupplements or for our brands of HA, the patients would be routed automatically to a direct purchase option. So someone from the specialty pharmacy will engage with the patient directly when they've been found to have no benefit. So that's another way for us to kind of streamline the process and the workflow around arming you and your patients with access to cost-efficient viscosupplements. And I say cost-efficient because, as we all know, the landscape around viscosupplements and coverage for viscosupplements has changed dramatically over the years. And unfortunately for all of us, it doesn't seem to appear that it's going to get any better anytime soon. So the premise around the direct purchase program was to effectively provide a simpler, cost-efficient way for patients to have access to our medications if they either had no access to viscosupplements or if they were looking to circumvent very long-winded prior authorization processes. So as you know, this has been quite a problem of late, where all these commercial plans have different preferred brands, and you have to jump through several hoops to have access or provide access to your patients to the brands that you actually are recommending or wanting to use. So in this regard, our direct purchase program basically was designed to offer access to patients with no HA benefits. And it was created to provide as much access as possible. So as you can see, the program eligibility here, there's only 4 things that you have to meet to have access to direct purchase program. So the patient has to be at least 21 years of age. They have to be a resident of the United States or a US territory. And they also have to have a valid prescription, obviously through this portal or through fax. Your practice and the patient themselves have to agree not to file a claim to have insurance cover for the medication because they're in effect paying for it out of pocket. So similar to when a patient has, their specialty pharmacy have them pick up visco supplement at the pharmacy and they walk it into your practice. This direct purchase program will effectively engage with the patients directly. And once the patient's transaction and pay for the medication directly, the medication or the specialty pharmacy will ship those medications directly to your office location where you've actually enrolled the patient from. We find that this program has really helped a lot of our clients, especially larger hospital institutions that have larger numbers of patients to kind of deal with and to prior authorize as well. Some hospital systems that we work with have just decided as a whole to move away from that prior authorization process in order not to bog down the organization and the staff to get these prior authorizations pulled through, as it were. So if you have any other questions on direct purchase, obviously my colleague Liz and I would be happy to answer them. So this webinar today is really going to take you through the new portal and the sort of functionality. So my colleague Liz is going to take you through the next steps, really, which for one needs to start with enrolling or registering your clinic to the portal, and then go through the sort of the benefit investigation process and the enrollments for direct purchase program, or as we call it, DPP. Take it away, Liz.
Thank you, Joe. Hello, everyone. Once again, my name is Elizabeth Sosa. I am the Regional Account Executive for Plymouth Medical and also the direct point of contact for anything HA related, such as GenVisc and TriVisc. So as my colleague just mentioned, this is our new portal. You may visit the portal by clicking in HARMOKNEE.support. Once you come to this page, you will see a registration link. Please proceed by clicking that link. Once you've completed the registration, in order for your account to become active, a verification must happen, meaning that Harmony will call your practice within 2 hours of your registration, or we will say that we basically advise you to call Harmony beforehand, as sometimes things can happen, delays can happen on both Harmony's end or also in the practice. You have patients. So the best course of action is to call Harmony upon your registration to verify your account. Once your account has been verified, you will receive an email to reset your password. And once you reset your password, you will also receive a BAA, and you have to consent, click off the box, and your account will become active from that point on. With this new system, we now introduce a multiple user login. So we can set up your office to have one individual login as a manager login, and you can create multiple users such as medical assistant, clinical coordinators, and you as a manager will have access and have an overview of all submissions being submitted for your practice. If your practice has multiple locations, we will then need to create a practice level account where we will need to tie all manager users to one practice to make sure that it all falls under the same practice. So if you do need help with that, please feel free to reach out to me directly. We can definitely assist you in setting that up if needed. In addition to your enrollment, anytime that you select a service with Harmony, you will receive an email confirmation basically providing you with an overview of what you submitted, whether it's for an eligibility and benefit verification or if it's for a DPP referral. Okay, in this screen here, this is our new patient benefit and prescription enrollment form. You can submit cases via two ways. You can either use this fax form, which still has the same fax number previously used with the Ascend Pharmacy, or you can register this service on the portal. So both services via fax and via the portal will need to be accompanied by clinicals. So patient demographic information, a copy of the patient's insurance, photo ID, medical notes, and so on. Both things can be, again, provided via the portal and fax. So you can fax in these clinicals. You can also fax in the submission and upload the clinicals into the portal. Whichever way is easier for your practice, you have two options. If your submission is missing any type of information, Harmony will reach out based on your preference upon enrollment. They will either reach out via email or they will reach out via phone. If they are reaching out via phone, they will attempt to call you at least 3 times. If at that point your office is not available, they will follow up with an email and your office will need to call to connect with Harmony and find out what is missing or what is needed to proceed with this benefit investigation case. I also want to take this opportunity to reiterate that Plymouth Medical is not allowed to call on behalf of your patients. We are not allowed to inquire about status updates, and we are not allowed to basically provide any type of submissions for your office. These are things that have to be done on your end. We can simply provide you with contact information or resources such as fax forms or tutorial videos on how to navigate this website. Okay, so in addition to the benefits investigations, once this is submitted, you will have real-time visibility as far as to the status of your submission. Same-day submissions are turned around the same day. So if you do submit any type of request, whether it's DPP or, again, for benefit investigation, as long as you submit prior to 2 p.m. Central Standard Time, you will receive a response on the same day. So if you submit a submission at 12 p.m. noon, you should receive an outcome within the next 2 hours based on the patient's eligibility. So you'll know whether the patient's covered or not and how to proceed. So the results will include the following. So this is something new that this portal is providing us as far as a coverage verification. The coverage will be provided for both medical and pharmacy benefits. Therefore, not only will you understand if you can buy and bill the product, but you will also understand if they have pharmacy benefits and how to proceed with that coverage. You will also receive determination for how much the insurance is going to allow for the product. You will also receive procedure information as far as reimbursement for the product and any other accompanying CPT codes. And lastly, you will also receive your patient's responsibility if they have a deductible to satisfy in order to receive this product, if they have a copay or a co-insurance. And lastly, prior authorization. Our pharmacy team will advise you if the patient does require prior authorization for both Genvisc and Trivisc. If our pharmacy deems that your patient does require prior authorization, the pharmacy will help streamline that process as long as clinicals are provided. It is very important when we are submitting cases, if they are for a benefit investigation, please ensure to have all clinicals provided. That way, if the pharmacy can take the lead and fulfill the entire process in a timely manner. If clinicals are not provided, then this will delay your process in getting your prior authorization. Harmony will reach out once again up to 3 times via phone and also via email if anything is needed or if anything is missing from your submission. If your practice decides that they do not need or want prior authorization support, the task and your submission will be closed. And Harmony will also provide your office with the necessary forms to submit a prior authorization if this is something that your office wishes to do on their end. Okay, so Harmony will provide as well the following. So obtaining payer-specific forms, as just mentioned. So if the patient, as you can see on the screen, has Cigna, has Aetna, United Healthcare, Harmony does have access to those forms. They will again attempt to obtain clinicals from your practice, and they will send everything over to the insurance company to start the process. If anything changes along the process, again, you will have real-time updates on this portal, and you can also connect with Harmony via phone, via email, or via chat with regards to this prior authorization. Now, the second portion to this portal, as you know, is our direct purchase program, also known as our DPP program. This is typically how we refer to this program for those that did not know. So enrollment, again, can also be submitted in two ways: via fax, using the same fax number that we've been using, and also via the portal. So the portal will provide you with the option to simply just choose DPP, as for those that have done so in the past. So it allows immediate enrollment. You will also have the option to select auto enrollment after no coverage verification. So this is extremely helpful. Once again, it just helps the process move along. And if you do have the discussion in office with your patient, advising them that this program is available and is a possibility. If they do not have every coverage, this will be an automatic process through Harmony. And then you will also have, the option of selecting this program as well after a benefit verification. So upon submission of the case, if you did not choose the auto enrollment, you will have the option to enroll the patient in DPP after the benefit verification. Very important to understand, this portal does work with two companies. So we have Harmony, and now we have Medvantix. Medvantix is our specialty pharmacy taking place for Asembia. So when your patients do receive a phone call or any type of communication with regards to the direct purchase program, they will be speaking to Medvantix Specialty Pharmacy. Medvantix will contact your patient upon receiving their information. They will collect payment, review the consent, and then they will ship the product directly to the ordering provider's office. Once again, there is not an option for the patient to receive the product. Whoever submitted the referral, submitted the case, is the office that is going to receive the product. Okay, and as mentioned previously, this is our homepage dashboard. This dashboard will give you visibility as to your menu options. So whether you need to create a new case, I want to check the status of a previous submission, and it will also allow you to see what the next steps are. So you will be able to have real-time updates. So as soon as any updates are made available, you are able to action immediately. You are able to make changes as well in this dashboard, and you are able to chat with live support. Okay, so checking checking your submission request in real time is very beneficial. We have encountered previously with our former portal, there are significant delays with contacting the office, or there's just delays overall. This portal will now provide you with faster service, a bigger team, and most importantly, patient satisfaction. That is something that is very important. We want to make sure that all patients have access to this product and are able to get the product quickly into the office as well. Okay, and last but not least, we also have a portal demonstration video on our website as we have before. So if there are any staff members that are not available for this webinar, or if you have any questions with anything that we just reviewed, please feel free to visit PlymouthMedical.com under our resource tab. You will find this portal there. This portal video. It's a very quick video, 8-minute overview, taking you through the steps that we just reviewed.
Thank you so much, Liz, for going into the details of registering your clinic and enrolling patients either through a benefit investigation pathway or the direct purchase pathway. As we all know, the changing landscape in hyaluronic acid is changing every quarter. And I think part part of the reason or part of the feedback that we get from our clients is that, for the last 12 years, we've had hyaluronic acid in our product portfolio. So we certainly bring a lot to the table in terms of our value add. So we're not just involved in selling you product, but also can help you navigate and make some decisions on what to do from a buy and bill perspective, from a specialty pharmacy perspective, and really from a direct purchase perspective. And certainly we've seen a lot of our larger and smaller clinics migrate and change their workflows depending on our advice in the past. So I think the value added sort of services that we offer as a company at Plymouth Medical is that we certainly make things a little more palatable to understand. All of these assets are found on our website at plymouthmedical.com under resources. So if you have questions about reimbursement for buy and bill, this is where you'll find it. If you have questions about enrolling your clinic, you'll find all of the information we reviewed on this webinar at our website under resources. Beyond that, we also assist all of our clients with their marketing and their patient education needs. This is really key. Again, what you mentioned or what the physicians or the HCPs mention in consult with their patients is one thing, but as we all know, patients tend to forget everything we say once they walk out the door of the clinic. So having something in hand or having patient education on direct purchase on the TriVisc or GenVisc product is also something that we can arm you and your practice with. So reach out to us if you need that information. Certainly on the direct purchase side, we found it very useful to talk about this or have a sort of a tear-off pad to give to patients so that they can call the MedAdvantix pharmacy themselves if they want to initiate the process faster. Beyond that, we're renowned for client advocacy and customer service across the orthobiologics field. Certainly, our clients have been happy to leverage our customer service over the years. So as you sort of go through the process, obviously this is a brand new portal. MedAdvantix and our co-pilot HARMOKNEE Reimbursement Solutions platform are being inundated right now with our thousands of clients that are registering their clinics. So there may be some delays, I would say, in the first couple of weeks of this launch. But if you have any issues, obviously myself and Liz as your primary point of contact will be happy to advocate for you and at least check in on the status of your enrollments and help iron out any issues. As you know, we do best. So unfortunately, we're running a little behind schedule here with 2 minutes left to the webinar, but we do have some questions that have come through that I'm gonna ask Liz to answer, if you don't mind, Liz.
Sure.
One of the questions that came through was, does the benefit investigation eligibility information that's provided back to the clinic, does that just cover for TriVisc and GenVisc, or does that include eligibility for other HA brands as well?
Great question. So yes, so the initial submission will be for GenVisc and TriVisc. However, because HARMOKNEE support is verifying medical and pharmacy benefits, the HFP will receive eligibility for other HA brands. So if there is a preferred brand that the insurance carrier wants the office to use, HARMOKNEE will advise you what that brand is and can help with that process in obtaining a prior authorization or obtaining any documentation that's needed for the office to be able to receive that product if they don't already buy and bill it.
Thanks, Liz. Do you know how many times MedAdvantix actually will call the patient or attempt to call the patient for payment if they're routed to DPP?
Yes, so MedAdvantix will try to contact your patient at least 3 times. However, I always advise the offices to provide patients with, again, as Jill mentioned, a tear-off pad or a brochure because it will have MedAdvantix information. I always suggest that, as sometimes, these calls can come across like scam likely. It's an 800 number, patients might not answer. So we do find it's best for patients to call in to speed up the process and make sure that they're speaking to the correct person. and that they, of course, are submitting their payment in order to have their order fulfilled.
Thank you, Liz. And again, to review, the pricing on DPP is, I know it's $97 per syringe for Trivisc, but there's a nuance to the DPP pricing per syringe for GenDisc. Can you explain why, or is it $58.20 for GenDisc?
Correct. Yes.
Yeah,
So,
okay.
so this is a new implementation from Avanos at the beginning of this year. So the patient is able to obtain 5 GenVisc syringes priced for a series priced at $291, which is equivalent to $58.20, which in turn is almost equivalent to a copay that your patient would pay if they were using their commercial insurance.
Okay, that's good to know. Thank you so much, Liz. From a patient education point of view, or the marketing to support our clients, one of the questions that came through is whether that information is available in other languages.
Unfortunately, at this time, the marketing materials for this program are only available in English. We have submitted a request for other languages, but at this time, only English is available. And once again, to reiterate, brochures and any marketing materials are complimentary from our manufacturer, Avanos.
Okay, I guess we should employ you, Liz, to translate it in Spanish and me to translate it in French.
I'm here.
All right. That's all the time that we have, unfortunately, for today. Again, this is a lunch and learn webinar that we're putting together, and you're going to see a lot more of these from Plymouth Medical. So quick, short 30-minute webinars to provide our clients with more information about what we do and how we do it best. Thank you so much for everyone's attendance today. Obviously, we have our contact details here. I'm sure there'll be a lot of follow-up questions. Again, if you forgot everything that we talked about today, we do have a sort of a training video that's available on our resource page at plymouthmedical.com as well. And then if you want to reach out to us directly, you can reach out at 888-392-5076 extension 8. Thank you very much and have a lovely weekend, everyone.
Take care all.
Bye.